Hi, I'm Kevin Ferber with American Cell Technology, and I'm here with Dr. Joseph Purita with PUR-FORM out here in Boca Raton, Florida. Actually, it's only about 35 minutes from our lab where Dr. Purita sends a lot of his patients to bank their own personal stem cells. We're actually here today because Dr. Purita is doing a reharvest on one of our previous clients who banked their bone marrow sample of stem cells, and he's reharvesting them, doing a mini liposuction of fat to send us their actually adipose-derived stem cells, because we can actually yield a lot more stem cells from your adipose, as they tend to be younger and more of them in your adipose versus your bone marrow. So with that, I want to introduce Dr. Purita. He was medical director here at PUR-FORM Institute. I've had the pleasure of knowing him over the years. He's not just a physician, he's also a trainer, an educator, an innovator. I've had a great opportunity of getting to hear you speak over the past handful of years and always come out with some more knowledge I didn't know. For this talk, though, I really want to touch on more like your regenerative medicine space and your experience. So could you tell us more about how you got involved in regenerative medicine and your background in the space?
Well, it's very interesting. I've always been intrigued by the cutting edge of the cutting edge, ever since I was a resident. And then one day, I heard about this thing where they were using components of the blood, and I was doing joint replacements, and I said, that sounds intriguing. So I said, let me try it. And I said, okay. And I kind of used something that was called PRP, which was very, very primitive in those days. So I put some in the wound and some on top of the wound, and lo and behold, the patients were getting better quicker. I said, I think we're onto something. And I just started pursuing it more and more. And then I started hearing about bone marrow aspirate. I said, okay. Then I heard about fat. I said, wait a minute, fat, that's kind of a worthless tissue. And little did I know that it was a gold mine of stem cells. And little by little, I started doing more and more. And then I had an aha moment also. I said, you know, if you kind of figure out how stem cells work and how they age, it's going to really kind of apply to everything that we basically do. And basically, it concerns our health. And I said, you got to learn about these stem cell aging pathways. And I just kept pursuing this, and here I am. You know, I don't even do orthopedics anymore other than 2 half days a week, just to kind of, you know, keep that iron, so to speak, hot. But I'm really dedicated to health span and well-being, et cetera.
Awesome. And could you tell us a little more about your experience directly in stem cell therapy, why you may use a certain type of stem cell therapy versus another, or why maybe autologous stem cells versus allogenic stem cells?
Well, you know, I have one slide that I kind of mentioned. Cells, not doctors, heal patients. I think that sums it up all. No matter what you're doing, if I'm going to give a patient a medication or your internist is going to give you a medication, he's trying to manipulate your cells to do certain things. But why not take it from the get-go and put the cells in there where they needed? And this is going to revolutionize and change medicine, cellular therapies. There's no ifs, ands, or buts about it. It's going to touch every field of medicine. There's no field in medicine that you can't pick up a book or whatever and say, oh, okay, look at how that's affecting that, you know, be it cardiology, orthopedics, et cetera. The other thing I like about this field, you know, as an orthopedic surgeon, I'm not going to ever make a big difference. I mean, big deal. But in this field, I can tell you, I can make a difference, and I have made a difference in certain things. We're always kind of pushing the edge, pushing the envelope to see how we make things better. And we found some things that really work well.
What has been some of your personal best results you've seen on patients in doing stem cell therapy?
As far as the best results I've seen, there have been many of them. When I have a patient who comes in and tells me, Doc, I was having trouble just walking around my house. Now I'm back playing pickleball. Or, you know what, I feel great again. I don't feel run down and listless and things like that. So there's so many different things. It's a whole conglomeration of things, not one in particular, but I know we're onto something and something good.
That's awesome. I think one thing I like to say is that we're probably in the most archaic time when it comes to stem cell therapy, right? We have no idea where we're going to be in 20 years from today. So from you on a personal perspective, and you're very forward thinking, what most excites you for the future in regenerative medicine therapy?
That's a very good question. What most excites me about stem cell therapy? It's where we're moving to. And I think we're realizing that we have to basically use our own cells. I'm still not a big fan of using cells from other sources. I think our own cells, which we call autologous cells, are really where it's at. And I think we're going to really make some tremendous strides against many of the neurodegenerative diseases. But more importantly, the real white elephant, or I should say the elephant in the room, so to speak, is aging. I think we're going to see tremendous results in the field of anti-aging from stem cells and their conglomeration of things such as exosomes, et cetera. And that's what most excites me.
So I would love to shift gears a little bit more to your patient-doctor relationship. So when they come into PUR-FORM Institute, what's it look like typically for a patient that wants to come and do the regenerative track with you and your team?
Well, I have a very frank discussion with the patient. I say, look, we don't cure things, okay? We're not at the point yet. But what I really tell most patients is, my job is to buy you time and to buy you your health span. And I'm hoping within 10 years, the way our technology is going, we may be able to take something from the cupboard, inject it into your knee or hip or whatever, and say, okay, in 6 months you'll have a brand new joint. And I think that's where we're moving towards.
And how does stem cell banking with us or your personal stem cells play a role in that, in your vision?
You only have so many stem cells. And one of the signs of aging is what we call stem cell exhaustion, where your numbers of cells are going down and down and down. Now, there's ways that we can make it better and we can enhance them, but still, when you have a bank, you have a tremendous number of cells that can be, made, and that's where it's going to really be beneficial for you, because it's a numbers game like anything else. And that's one of the reasons why I want to work with American Cell Technology, because I know it's an entity that I can trust, and I would give it to myself or my family with no hesitation.
I think there's a lot of misunderstanding of people reading literature on stem cells. And stem cells is a very vague word. And some people think they have to go out of the country for this, and they can't have this done in the US. So would you like to shed light a little bit on what you do here at PUR-FORM and how you're able to do and treat people with their own personal cells versus maybe going abroad and getting allogenic or donor cells?
Many people say, hey, doc, should I go out of the country because I can get these cells and they're much younger and they're going to be healthier and this and that? I said, well, there's no real reason to do that. We can pretty much do many of the things that they're trying to accomplish there overseas, but I think we can do it better. And there's a couple of reasons why. First of all, when you go overseas, they'll tell you, well, these cells are immune privileged, meaning that the immune system in your body is not going to bother them all. That is not the correct thing. These cells are immune evasive. Your immune system is going to go after them and eventually zap them. Okay, that's number one. Number two, there's nothing as good as your own cell. The problem that we have is we may not have the proper numbers. Now, when we can incorporate that with a cell expansion of your own cells, that's going to be something good. There's no reason to go out of the country at all. We have a litany of cells that we use here. We use bone marrow, we use fat, adipose, we use PRP. And remember, I like to tell patients, it's not just stem cells sometimes. It's a whole litany of cells, of which the stem cells are very important.
Absolutely, that makes complete sense. And for the process of a patient coming in here, when they want to do stem cell therapy or bank their stem cells with you, what does that process typically look like?
Well, when someone comes in and says, what's involved, I tell them, well, the following is involved. Basically, we have to come to a conclusion that it's something worthwhile for the patient. I mean, there's some patients that come in with unrealistic expectations, and I'm going to say, I'm not the guy to treat you because I don't think I'm going to help you. But if I have someone I think I can help, then I'm going to say, okay, you have a couple of options. We're going to take your bone marrow. We're going to take some of your adipose, your fat tissue. But you can consider also taking a little bit extra fat tissue. We could send it down to a lab, and you sort of have an insurance policy because we have your stem cells that we can basically put in a bank, and when they're needed, we can say, hey, we need you guys to go ahead and reproduce these cells and give us large numbers of them.
And in your opinion, if everyone's positive and receptive and wants to do it, who would be a candidate to bank their stem cells?
Now, this is now the art of medicine. I mean, not everyone is a candidate for it. There's certain people that may have certain diseases and things like that that I would probably figure they're not a good candidate. But most people would be a candidate, I think. There's no reason not to bank your cells.
What are some of the reasons why they would bank their stem cells? I think some people think it's just for the exclusive rich or the pro athletes that are banging up their bodies, but would love to. You're seeing patients every day. Who do you think could benefit from banking their own personal stem cells?
We're an active society, and we're going to have wear and tear of our joints and things like that. Now, someone can come in and get an adipose, basically liposuction, things like that, but you're still not going to get the number of cells you need. Now, once we do that adipose liposuction and we send it down to the lab, all of a sudden those cells get expanded, and we can just call up and the patient says, hey, my knee is bothering me. Okay, maybe I'll take some PRP or something, but we'll also call up and get some of your cells. We'll inject it in there. And it just is a much easier situation than it would be otherwise. So it's convenient for the patient, and it's not horribly expensive. We're not talking about hundreds of thousands of dollars or tens of thousands of dollars even. We're talking about things that are very reasonably priced for many people.
Are you typically treating patients with their cells for orthopedic cases, or are you also doing systemically for different conditions as well?
I treat the majority of patients with stem cells for orthopedic conditions. However, we do also look at autoimmune conditions and things like that. So there's a whole litany of cases, and it basically runs the gamut. There's some things that I'm going to say, look, I don't think we're going to help you with this. I wouldn't take your money, sorry. And there's other things I'm going to say, hey, look, I think there's a good chance we're going to help you.
And I think we had this discussion a little offline, and research is still coming out on kind of quantifying the amount of cells you may need per treatment, and I know different use cases depend, but in your experience for like the average consumer, how do you think about cells and how many cells they may need for an orthopedic condition versus a systemic condition? How often would you want to see them for follow-ups to continue to evaluate them to see if it's a fit?
That's something that's difficult to answer as far as how many cells someone needs. I mean, it's really kind of like a menu, and you're sort of like a chef in that you have to kind of tailor the dish, so to speak, to the patient. So for me to say you need 100 million cells, I really don't know. No one knows, but we have some guidance from studies that are out there. And I also like to give cells both intravenously, where it goes into the vein, and into the joint, because I think that gives you the best chance. And I've been doing that for years.
I think can be a misconception because people are such used to steroids or cortisone shots to see instant relief. In your experience, how are you educating patients on the cells healing themselves and how long that may take?
Okay, so about cortisone and things like that. I had an old professor of mine once. He said, you know what, Purita? Cortisone's a good drug to make your patient walk to his grave. And he makes sense. Cortisone, there's no free lunch. When you get cortisone, you walk out of there and you say, hey, I feel great, And I tell patients, look, you're going to get the stem cells. You're not going to feel so good for a couple of days because they're going to cause an inflammation. But in the long run, it's going to be much better for you because that cortisone that's making you feel great is causing further destruction and degeneration in your joint.
And it could take time for your cells to heal themselves, I imagine, versus a cortisone immediate shot.
When you do cellular therapy, you're talking about time. It's like renovating a house. You don't renovate a house over a weekend. You renovate a house, it takes many weeks. You want to renovate something, you want to fix something before it gets to the point of no return.
Absolutely. And I think that's why we're so excited to continue working with you, Dr. Purita, is that for systemic issues, for instance, like renovating a house is a perfect example. You're not going to fix something one and done, but could you provide potentially a quality of life, a better quality of life is the question.
Absolutely. One of the things that stem cells do, especially MSCs, they do something called immune modulation. What does that mean in regular English? They get the immune system to kind of calm down. And you see this in a very practical term. You get a cut on your hand, you kind of put pressure on it, and you say, good, it clotted. And you're going about your business, and 2 or 3 days later you say, oh my God, it's mean, red, and angry. Am I getting an infection? No, it's an inflammatory response. But what happens is your stem cells go in there and they calm that down so other cells can do the repair. I liken stem cells, MSCs in particular, to Navy SEALs. They're very specialized. They get injected into an area. It's a very hostile area. They may not survive, but they're going to get that area cleared so the rest of the cells can go in and do their work.
You've been around the space for a while and would love to hear from your opinion. You talked a little bit about the risks of allogenic stem cells. Do you see much risk in autologous cell therapy, autologous stem cell banking? What should patients be aware of?
Look, anytime you do anything intravenously, there's always a risk, but it's pretty much infinitesimal. When you're using your own cells, your body's going to say, oh, come on in, I welcome you and everything. You're using allogenic cells, it's always an immune reaction. It may not be something that's going to be big, but eventually those cells do get nailed by our immune system.
It's funny you say that. I was listening to someone present from an international stem cell company that's giving allogenic cells and pushing them down a pathway to treat certain conditions. And he was presenting an IV therapy and saying, IV therapy, allogenic culture expanded cells, they'll put you on your butt for a few days and you're going to have a reaction. And initially he wasn't saying allogenic. He just kept saying culture expanded cells. Like, well, I've never heard of that response from any of the practitioners I work with. Or what are you actually giving them?
Well, basically you say you're not going to have a reaction to these cells because of the fact that they're your own. Okay, simple as that.
I really appreciate you, Dr. Purita, taking the time. I think we'd love to see the facility and see all the different tools you have.
It's been my pleasure, and I love working with you guys. I mean, like I say, I would stake my life and my family's life with you guys.
Thank you, Dr. Purita. Appreciate your
My
time.
pleasure.